Hi, and welcome to Starkey at a Glance. My name is Judy Grobstein, Manager of Education and Audiology at Starkey, Australia. We know that millions of Australians suffer from tinnitus. Today I'm going to talk to you about some of the more common causes, triggers, and treatment of tinnitus.
So what exactly is tinnitus? Tinnitus is defined as the perception of sound when no actual external noise is present. It's commonly referred to as ringing in the ears, but it can present in many forms, most likely described as buzzing, hissing, whistling, swooshing, and clicking. We've all heard those, just to name a few. And it can be a temporary or ongoing challenge that can be very difficult for our patients to live with. So how many individuals suffer from tinnitus in Australia? Well, about 1 in 3 people have experienced tinnitus in some form at some point in their life, and about 1 in 6 have constant tinnitus symptoms. And although the exact physiological cause for tinnitus is unknown, tinnitus research has consistently shown several likely sources that can trigger tinnitus. The most common include noise trauma, medications, disease and health-related problems, head and neck injury or trauma, and hearing loss. So let's take a closer look at each of these. First of all, individuals who sustain or experience some form of head or neck injury can report the onset of bothersome tinnitus following the incident. Common head or neck trauma include a skull fracture, whiplash, or possibly a blow to the head or face. Also, individuals who have TMJ disorders or other jaw-related problems can experience or may be prone to tinnitus. And research indicates that individuals who have tinnitus that arises from a head or neck injury typically will seek medical attention sooner than other tinnitus patients. And a possible explanation for this is that head or neck trauma patients typically estimate the noise level of their tinnitus to be higher and typically suffer more daily problems because of their tinnitus. In addition, as we know, there are a number of disease or health-related problems that are not directly related to the auditory system, but can in fact trigger the onset of tinnitus. The exact mechanism of how these conditions may cause tinnitus is not entirely understood, and some of the most common examples could include cardiovascular disease, thyroid problems, diabetes, hypertension, depression, and even multiple sclerosis. Another very common source, even probably more than we realize, is the use of certain medications. Currently, there are over 500 over-the-counter and prescription medications that cite tinnitus as a possible side effect. And although not every individual will experience tinnitus as a side effect, and typically most won't develop tinnitus symptoms at all, for those who do, the tinnitus may be temporary or it may be permanent. We often see that the tinnitus will subside within a few days of the individual stopping the medication, but there obviously are no guarantees of that. And typically, drug-induced tinnitus is reported as a continuous high-pitched sound in both ears, but a variety of descriptions have been reported. Some of the most common known medications that can cause tinnitus include antibiotics, painkillers, anti-inflammatories such as aspirin and ibuprofen, chemotherapy drugs, and diuretics. And this probably comes as no surprise, but obviously noise is by far the most popular cause of tinnitus for the majority of our patients, and it may or may not occur simultaneously with the hearing loss. A noise trauma can obviously be due to a repeated unprotected exposure to loud sounds, such as somebody who works at a factory, in construction, perhaps lawn care. And it can also occur from a one-time loud exposure to a very loud sound, such as maybe a gunshot, firecracker, or explosion. The tinnitus that results from noise exposure can occur suddenly or gradually, and when it occurs suddenly, it is often perceived as a fairly loud volume that may persist at that level permanently for that individual. However, for some, the tinnitus is temporary and does not return. More commonly, the onset of noise-induced tinnitus is gradual and intermittent, and in its early stages, patients report maybe a mild form of tinnitus over a short period of time following exposure to loud sounds. Typically, once a patient is removed from that noise source, the tinnitus will soon diminish and can be inaudible over the next exposure time. The intermittent pattern can continue for months or years, with the periods of tinnitus becoming longer and longer until eventually that tinnitus can become constant. We all know that noise trauma can lead to hearing loss, but we also know that hearing loss can happen for a variety of other reasons. Regardless of the reason for the hearing loss, the presence of hearing loss is commonly associated with tinnitus, although it is really important to note that not every individual who has hearing loss will experience tinnitus, and not every individual who has tinnitus will have hearing loss. There are a number of auditory pathologies occurring throughout the auditory pathway that can be associated with the report of tinnitus. So while patients with tinnitus often have some degree of hearing loss, there are many who don't, just like there are many patients who have hearing loss but don't necessarily experience tinnitus. However, it should be noticed that tinnitus definitely is more prevalent among the hearing loss, among those who have hearing loss, than it is with those in the normal hearing population. And when we take a look at factors such as severity, type, cause, and onset of hearing loss, tinnitus seems to really have no specific pattern. So tinnitus can occur with any degree or type of hearing loss, with any cause of hearing loss, or any type of onset. The severity of the tinnitus is also not related to the severity of the hearing impairment, and changes in hearing loss and changes in tinnitus seem to occur independently of one another. The tinnitus can increase or decrease without any change to the hearing, and the hearing could get worse, but the tinnitus remains unchanged or could seem to fade over time. So there's really no pattern there. And when we look at a patient's hearing thresholds with respect to how tinnitus is affecting them, research has shown that there is no correlation between tinnitus severity and hearing thresholds. Here you can see a graph that shows tinnitus symptom severity as measured by the tinnitus handicap inventory there on the horizontal axis relative to the best hearing thresholds on the vertical axis. And you can see that the results are really all over the board. This shows us that the audiogram really cannot in any way predict just how impacted a patient may be when it comes to their tinnitus. Research does tell us, though, that regardless of the age, as hearing loss increases, the likelihood for the tinnitus will also increase. So this information may be useful to us as clinicians when it comes to counseling patients on using hearing protection appropriately. Now, in addition to the multiple causes of tinnitus, there are a variety of things that can actually aggravate or exacerbate the tinnitus. These items can make the tinnitus worse, usually for short periods of time, and can include things like alcohol, noise exposure, high doses of aspirin or caffeine or salt, as well as stress and anxiety, such as maybe going through a divorce, a change of job, moving, loss of a loved one, and so forth. And usually once that stressful situation has resolved itself, the tinnitus can subside as well. And in this case, counseling is incredibly important in having the patient avoid or cut back on some of those stressful activities or some of these other items like alcohol, caffeine, and so forth. Now, when it comes to tinnitus, there is no cure for tinnitus, but we know that it certainly can be managed, and management falls into 3 specific categories, and those include amplification, counseling, and sound therapy. Sound therapy involves the use of an external noise to alter the perception of the tinnitus or the person's reaction to it. Studies have shown that patients experience the greatest perceived benefit when it comes to their tinnitus treatment when multiple methods are combined and an individual treatment approach is provided to them. So not just providing them with amplification alone or sound therapy alone or just counseling, but a combination of the 3 of these items. Now, when it comes to sound therapy, the American Tinnitus Association defines sound therapy in this way. It involves the use of external noise in order to alter the patient's perception of or reaction to tinnitus. Like other tinnitus treatments, sound therapies do not cure the condition, but they may significantly lower the perceived burden and intensity of the tinnitus. And a really helpful analogy for sound therapy involves thinking about lighting a candle in a lighted room versus lighting a candle in a dark room. The flame of the candle in a dark room is incredibly bright. You can see it well. But once it's moved into a well-lit room, while you can still see it, the flame becomes less noticeable and less bright. In essence, tinnitus is most noticeable when there are no other environmental sounds present. So this can make it difficult to function on tasks when in a quiet room, or difficulty falling asleep in a quiet room, whilst when they're out in an environment with other noises, they won't perceive their tinnitus to be as noticeable. As you know, as well as anyone, that oftentimes our patients will ask if there's anything that we as a clinician can do to make their tinnitus stop. Because there is no cure, many healthcare providers will often tell the sufferer that they have to learn to live with it. That, however, is definitely not what a tinnitus patient wants to hear, as they've been experiencing it for quite some time. They've been not successful with finding relief from the tinnitus, and that's why they're here to see a healthcare professional. And that's where our Multiflex Tinnitus Pro comes in. So this is Starkey's next generation feature of sound management, and it really extends the flexibility of our existing tinnitus technology with two new signals that include audiogram shaped and custom.
Thank you so much for watching. Should you require more information on this topic or others, please feel free to contact us on our toll-free number 1-800-024-985 or reach out to your product specialist directly.